What's up? It's Dr. Glenn Vo, and man, I got literally the best Vietnamese dentist in the United States on air right now, Dr. Thomas Doan. Thomas, how's it going, buddy?
I'm doing good, man. It's a little bit flattering. I don't know about the best, but
The best Vietnamese dentist in the United States. So anyways, I wanted to bring you on. So I got to know you, on social media. And what's funny was that I was actually at one of your society meetings, and we probably just walked by each other, but I didn't know you at the time. And it's like, now that we've gotten to know each other, I was like kicking myself because I was in Orlando for the annual meeting. And literally I was there because I was looking around at where did I want to bring my team. And I'm like, oh, let's go to Orlando. Went there, but it was such a great meeting. And we got to talking, and I said, Thomas, you know what? You're the president of the Florida Academy of Cosmetic Dentistry. All right. That's a big deal. Okay. That's a big deal. I tell you that all the time. You're like, nah, that's all right. That's all right. But it's a big deal. And we got to talk, and we're like, I would ask you, it's like, it seems like there's a lot of apathy, and just people joining organizations and whatnot. And this being a part of the Florida Academy of Cosmetic Dentistry is so important to you. I wanted to bring you on, and let's talk about that. Okay, let's start off with that. Let's talk about why is it important to join an organization like an ADA or a cosmetic dentistry organization or AGD or any of those things. Let's talk about that. Why is that important for dentists?
Well, first thing off is that with any organization, I mean, we need to know why you want to join in the first place. What is your main purpose? Why you wanted to be in, whether it's the FACPA, ACP, or any other organization that promotes dentistry-wise. And what it comes down to is just developing a culture beyond dental school, right? We get to the point of going to dental school, and we learn just to get by, essentially, right? I mean, I know some students that came out of dental school, and I got to wonder, is he going to practice dentistry or what? But at the same token, you need to be able to develop not only your professional skills, but also your personal development too. And part of that is really joining an organization that kind of fits in your basically core culture. I mean, your purpose of why you want to do dentistry in the first place. I mean, I think we all came into dentistry for a specific reason. Some people think it's, oh, I want to have a certain career in dentistry. Maybe I'll make some money and enjoy my life and doing this bigger part. But I think inherently, I think we do dentistry because we have a love for it in some sort of capacity. Maybe we don't know it quite just yet. But then we develop a certain skill level to a certain point when you graduate. But then you're off on your own. And now you're kind of lost a little bit because you don't have your professor there anymore. You don't have an advisor anymore. What you really need is a mentor, all right, than anything else, all right? And to help you kind of guide through your professional career. And I think that's where organizational dentistry is so important. It's particularly ones that are maybe not so big that you kind of get lost in the numbers. But rather something that's much more intimate, and then you can develop something very significant in your own life.
Yeah, I love that. And then you were talking about how, most of us get into dentistry for a particular reason, for a certain lifestyle, for the love of it. I actually got into it out of fear. Out of fear of getting beaten by my parents, if I didn't become a doctor, So no, I'm just joking. That's an inside joke for most Asians. I'm just joking there. But let's go back to. So let's talk about the organization that you're now the president of, right? So I was looking through the past presidents, and man, you guys had some legit ballers who were. Guys like Jason Alitsky was the president. You have Mike Brum. You have Bill Strupp, who's like the OG of like cosmetic dentistry in Florida. And so just looking down the list, wow, there's a lot of people who are part of this. And so what drew you to more on an organization that's more focused on cosmetic dentistry? What kind of pushed you there?
Well, in my own practice, my practice is maybe unique than most practices. I'm a fee-for-service practice. I don't deal with any bigger insurance and so forth. And primarily, my side of dentistry has been more cosmetic prosthodontics. However, with all that being said, they kind of gravitated to me getting into cosmetic and so forth, I actually was a long-time member for the AACD, almost 19 years now, ever since I came out of dental school, because I felt that I was really good with my hands. All right, yeah, I was okay with endodontics, I was okay with surgery and so forth, but I was really good in terms of crafty stuff. All right, and and doing things that kind of thought beyond of doing a very specific procedure. And so I got involved with the AACD pretty early in my career, and it was great. When the AACD was booming in that particular time, I think that time was also when Bill Dorfman was doing
the Extreme Makeover.
It was like the boom of cosmetic dentistry at the time.
Right.
And so, and I developed a career around it. Then going through Dawson and other continuums, you start to develop a certain skill set, and maybe in that skill set kind of drove you to better types of dentistry. Not necessarily like the run-of-the-mill drill and fill. That's I'm not saying that that's not good dentistry at all. I think there's a purpose for that. All right, but I wanted something that would be better for my patients in a comprehensive type of way, a multidisciplinary type of way. And so I've developed teams that do those type of things at dentistry, and then going into organizations like the FACD. It really started to hone in the skills, and it wasn't not just necessarily just from the CE courses or anything, and which are fantastic. It was actually this culture of great dentists getting together and then talking with each other about their particular things in life that they're doing, whether things that are doing them professionally, things that they've had hangups with their own type of dentistry in themselves, and we share ideas. Some of that is really the greatest learning I can ever ask for. I mean, I think there's a motto, something that said, "You are a composition of the 5 people that are closest."
Oh yeah, Jim Rohn. Yeah.
Yeah.
And I think that's something that whenever someone comes up to me and says, well, why are you part of these organizations and whatnot? I mean, I'm not getting anything out of it. And really, it's what you put into the organizations, number one, right? But number two, with social media has its purpose. I mean, people are watching us right now on social media, but there's something really special when you actually meet people in person and really connect with them. And I think that's what I love about these organizations. When I was in Orlando at the meeting that you guys had in Orlando, I was from Texas. I didn't know anyone. And I tell you what, like, people came up to me and they're like, hey, we haven't seen you at any of these meetings. And I'm like, no, literally, I'm from Texas. I signed up literally because I wanted to go to Orlando and talk to my team. And I mean, I just met so many people there. I met, Elijah, and Amanda. They were in the class together with me. That's where I met them. And now I'm like,
and they're not from Florida. Yeah, and they're not from Florida either. So
yeah, they're not. So that's what's so amazing about these organizations, because it's something to be said when you actually meet someone and actually network. The CE was good. The CE is good. But the networking, the mentorship, getting mentored or mentoring someone else, I mean, that's where the true magic is. And cosmetics is what you kind of drove you, but there's so many other organizations out there. Like, I mean, if you want to do more of a certain type of dentistry, right? I mean, dentistry is so vast, you can practice whatever you want, but you just join whatever organization and figure out that niche, and you don't have to be part of one, you can be part of many. And so I want to go back to what you guys are doing in Florida here, right? Okay. So talk about some of those things. I love your promo videos. I don't know how you guys with the exotic cars and stuff like that, but let's talk about what you guys are doing next. Like, talk about where the next meeting is going to be and what's on the pipeline for you guys.
Well, right now the current meeting is in Orlando again. I mean, we pretty much centralized Orlando as our kind of core meeting place, because it tends to gravitate from all different regions in Florida, but also as a hub for people who can fly in.
Oh yeah.
So it's being held at the Hyatt Regency Grand Cypress this year. But I want to, it took me 4 years to kind of get this speaker group together. I mean, it was that difficult to get these speakers. One is Nazary Mikhailiuk from the Ukraine. He is probably own continuum called M-Vision. But if you're talking about microscopic, highly detailed, digital scanning, digital printing, everything digital, and complete integration from the analog to the digital world. He's probably the foremost known to me. And he's actually young. I believe he's only like 33 or 34.
Oh, wow.
But I mean, it's amazing how some of these guys are out there who are stretching the limits, if you will.
Oh, yeah.
And just testing it. And so he's coming from the Ukraine. We have Milos Milanov, who is from Romania, and most people know Milos from Shoot Like a Pro. He has that high impact photography, but he's a talented lab technician out in Romania. He has his continuum over there as well. And then we have Kyle Stanley coming from Beverly Hills. Now, Kyle is a good friend.
Sharp dresser.
What's that?
He's a sharp dresser.
He's a starter. He was a former model back in the day, and but
that explains all those pictures he has.
That's right. But he came from a different background altogether. I mean, he was a former model, but he got into dentistry over at USC, and Dr. Pascal Manier took him as a mentee early on in his career, and then he went down to Brazil to learn implantology, and then now with Sasha Jankovic, and then now he has this collaboration with Christian Coachman, with the Oral Facial Club, and incredible speaker and very engaging. Well, that's one of the things that what I like about our particular speakers. They're very engaging, not only from our own community and culture-wise. We like to engage with our own membership, and that's how we select our speakers too, because it's not just of me talking to you and saying, okay, this is how you should do it, this is how I should do it. All right, how do we deal with these bigger problems that we encounter in dentistry every day? I mean, how do I do it? How do I encounter it? And we share ideas with each other, and we learn from each other, and that's really what the culture of learning should be about, is this collaborative effort, not just of me telling you what to do, but how we can do dentistry better for our patients.
Yeah, I love it. I mean, that's a high level speaker group. That's a higher level lineup right there.
We have Shannon Pace Brigner. Well, I almost forgot, for our teams too. And if you know Shannon, she's like the dentist, a dental assistant doctor, you might as well call it.
Yeah.
It's phenomenal.
Yeah. So let's talk about that. What's the date for the meeting? What date is that? When is the meeting?
That is going to be on August 22nd to the 24th of this year. It's just around the corner. It's just less than 2 months away. I mean, I'm still in that, planning mode. We're still getting all the logistics done, getting all the vendors in place, getting all the little details on. If you ever actually planned a super meeting, it is is balls to the walls type of thing, because last couple of months it's literally trying to get them the message out there, but also communicate with other people too. So
I mean, that's the great thing about the date that you picked. It's right when the kiddos are right when you go back to school. Maybe some people, your kids are already back to school and you want to just kind of get away from it. But I mean, it's like I said, I went to the meeting a few years back in Orlando, and I had such a great time, right? I'm not even from Florida. I went there, literally didn't know anyone. And by the time I was done, I met like so many people, met people that I'm still friends with today. So that's an awesome lineup there. And so we'll put in the comments, Thomas, I'll get you to put in the comments section more details about that.
Sure.
But let's talk about people who are in Florida right now, and they're not part of an organization, right?
Yeah.
So they're in Florida and they want to join. Like, what's the best way to get connected? Is it just to sign up? Is it just to talk to someone who's already a member? What's the best way to do it?
The best way to do it, if anything, is always connecting with someone who's in it too, because they want to. It's easier to sign up for anything. But if you sign up for something that you don't really know about, you don't understand where things are coming from. All right, I think that was the best way. It's not always the perfect way where people just see the kind of the show per se. All right, but I'm readily available. I mean, if you're on Facebook, just message me. I'll talk you through it. I'll even call you if you want. And I like to talk to people in terms of whether they got into dentistry. How can we improve your dentistry? All right, from not just even just from the clinical side, and how we do things in the managerial side of things. Right? We all have the same problems. We all kind of deal with the same stuff. Patients don't really change. Some patients are a little crazier than others. Yeah, I get that. All right, but it's all about the same thing. It's a people business. I mean, the dentistry part of it is the nuts and bolts of things. I mean, if you talk about dentistry, it's really how you connect, all right, with your patients and delivering the best that you can deliver. Certainly, we can give you the tools and getting your clinical dentistry even better. But if we can communicate our patients and doing that way, I think it's going to be a better world altogether.
So, I'm gonna ask you. I'm gonna do some couple of rapid fire questions here. But the first thing I want to ask you is, so whenever we talk about whenever cosmetic, the word cosmetic, the phrase cosmetic dentistry is plastered on social media or in any of these groups, right? Then it's kind of like, oh gosh, one of those guys, or you're doing this and that. But let's talk about cosmetic dentistry in the sense of helping a practice grow, right? Yeah, sure. So you're a doc and you're watching it right now and you just do bread and butter dentistry. I do that. Everyone does that, right? Oh, yeah. But, I want you to talk about if you add certain facets of cosmetic dentistry in your practice from a growth perspective, let's talk about that. Let's talk about someone whose bread and butter is watching right now. That's all he's doing. But he's like, okay, well, what can I do? What can cosmetic dentistry do for my practice?
Sure. I actually had this conversation with Kyle Stanley not too long ago about the term cosmetic. It's become the vernacular for dentistry if you want to do the foo-foo or the pretty dentistry, right? And I get the same thing too. I mean, do I really want to call me as a cosmetic dentist? I mean, to a certain degree, I kind of am for the marketing point of view, all right? Because the reality is that the guys who are doing high-level cosmetic dentistry is really not doing the super wide plastered fake smiles and so forth. They're really doing aesthetic dentistry. But most laypersons is like, what's aesthetic dentistry? Yeah. Is that something new? I mean, people know what cosmetic dentistry is. So incorporating cosmetic dentistry does not mean that you have to do veneers from tooth number 2 to tooth number to 15 by all means. I know some of the guys do that, by the way, but it really has to do with how do you improve a patient's overall smile, and it could be that it's a chip on a tooth, all right, and you can fix it with composite and so forth, all right. But how do we develop in a way that it is efficient, aesthetic, and then really blends in with nature? A lot of talk these days in terms of in our world is not necessarily recreating nature, but just copying it. All right. How do we just give back what is God given? That's how I relate to cosmetic dentistry. It's like there's some people who are like I want to look like Kim Kardashian or some of the social media icons out there and so forth. And I get that. And some people want to look super bright. That literally they will glow in the dark. But at the same token, there is aesthetics, all right? And what I differentiate cosmetic dentistry and aesthetic dentistry is really, one is something that is man-made, and one is what is God-given, all right? And if you kind of intermix the two, we can have some sort of harmony with each other and develop a way that can not only improve your dentistry, because cosmetic dentistry is that you're being much more detailed in terms of little tiny facets of things. And you actually make you a better dentist overall. All right, and we're talking about even not just teeth. We're talking about surgery. All right, we're talking about orthodontics. We're talking about periodontal surgery. I mean, all those kind of come in the realm of cosmetic. And then nowadays we're talking about how we look at the lips and everything else, and how we look at the face. All those little facets that kind of culminate together basically allows patients emit their particular emotions by facial expressions. And part of it is our job in terms of doing our part. And how we can affect everything else. So
I mean, that's what it's all about, right? Just basically improving the lives of our patients there. And I think that's what happens, that people kind of get lost in that phrase cosmetic dentistry, and some dentists kind of get lost in that, but it's a lot deeper than that. And it's not what we think of, or what even layman's people, I mean, the normal population thinks of, is like, okay, yeah, I've been here, like a roundhouse the brown house veneer all the way across. There's more to that. So let me ask you this. So for someone who's been in dentistry, who's a veteran like yourself, right? Who's part of like a really nice organization, you're mentoring other people there. I don't know if this will, I don't think this will get you in hot water. This is your opinion. Okay. So I want your opinion. This is Thomas's opinion only. Okay. Young doctors watching right now.
Yeah.
Top, I was going to say 5, but give me the top 3. Top 3 cosmetic dentistry courses they can take.
Top 3 cosmetic.
Top 3. Thomas's opinion.
Wow.
All right, we're keeping this non-political here because he's the president of Florida Academy of Cosmetic Dentistry. All right, he loves everybody, but his opinion, top 3 young dentists watching right now.
Okay, so top 3. I mean, if you talk about continuums, all right.
Yeah, we're throwing that into.
What's that?
Yes, we're throwing that. You can include the continuums.
All right, so. And this kind of, you put me on the spot, man.
Non-political. This is Thomas's opinion only.
Well, I would tell you in terms of, because I think cosmetic dentistry as a term shouldn't be solely related to making teeth look good. Right. Well, I think of things in terms of biology, structure, then whatever thing else making things look good after that. So in terms of continuum wise, I would say certainly Spear Group, Coyce, Dawson. I'm a Dawson, but I graduated from Dawson, and I've learned a lot of things in terms of multidisciplinary type of practice and also occlusion. So I got a lot of foundational stuff from Dawson. But there are so many things like DSD. I mean, with Christian Coachman.
Yeah.
I mean, I don't know. Top 3 is a tough, tall order. I mean, yeah.
Okay, so let's do this. Let's switch it up switch it up then. For a young dentist, less than 5 years, what are the courses that they should be zeroing in right now? Less than 5 years out.
Less than 5 years. They need to know core basic dentistry. All right.
Foundation.
All right. And actually, those top 3. I mean, if you're in Florida, go to Dawson or Pankey. All right. If you can make your way out to Seattle, go to Coyce. If you go out to Arizona, go to Spear. All right. If you want to use the Florida Academy of Cosmetic Dentistry as a leading step, because we have a partnership with Spear, and so it kind of, we have this collaboration with them. And being in Florida too, obviously, we have Dawson. But actually, I want to give a shout out to Bill Strupp. Bill Strupp and Mike Brown.
We had someone just give him a shout out just when I brought his name up. Someone just typed in Amanda Sheehan, who's like probably one of the most talented female dentists out there. Heck, not female, talented dentists out there. She's awesome. She just gave him a shout out there. But yes, Bill Strupp.
Bill Strupp. You know what? I am going to actually kind of. I'll re-rank this. If you're talking about the first 5 years out, they need to go see Bill Strupp and Mike Brown. I mean, they are nuts and bolts how to do the dentistry right for the very foundational part. I mean, I went to their course this year, and it was, and I've been in dentistry for a long while. And a lot of things I've said, there was really mind-blowing. I mean, doing solid dentistry, and that's what you really need. And after that, you kind of develop your own skill set level in terms of the little nuances and so forth. But for those guys coming out,
Well, Michael. I mean, I invited Michael to Mike Brum to watch this live, so he'll probably watch it eventually. But Mike, if you're watching, Nifty Thrifty deal, please, for the next course. Another one in 2020. I went to it, and I'll tell you what. It was. I mean, it was a lot of info. I mean, I won't lie. It was a lot of info, but for the amount of money they charged for it, it was worth every cent. So absolutely. Well, that's awesome. Okay, so put you on the spot there, but for a young guy coming in there, I would say this, right? I mean, the 3 continuums that you just basically mentioned. I mean, they're all good, I would say if you're a young dentist and money's tight, right? Money's tight. You're trying to nifty thrifty your way through dentistry and through life, right? You're trying to count, watch your money. Pick the one that's closest to you, man.
Oh yeah.
Pick the one that's closest to you, because it's not just one course; it's multiple courses. You'll be coming back. So if you're on the West Coast, go to the West Coast side. If you're on the East Coast, go down to Florida. If you're right in the middle or something, then you could probably go to. I think going to Arizona from Texas and Florida is about the same distance. So just pick which one works better for you. But
although Mike and Bill, they're actually doing a course in San Diego in 2020.
So, it's in San Diego.
Yeah, they're doing both.
Clearwater again.
They're going to do East Coast, West Coast deal. So they're going to do 2 courses. They're going to do one in San Diego. Oh
man, those guys, cool, man. Although I love Clearwater. So hey, Thomas, so that's an awesome advice, man. Hey, I just want to, I noticed that there's a few Asian docs that are watching right now, and I wanted to kind of hit this part here because there's so many Asians in dentistry, and I kind of. Honestly, man, I kind of look up to you, man, for being like the president of the Florida Academy Cosmetic Dentistry, and so I'm really proud about that. So I want to talk about that, man. I want to talk about like how like what your upbringing was like, and like what your family dynamic was, your brothers and sisters, and did you always want to be a dentist, or how did you kind of shift into that and got into dentistry, or was it the typical Asian thing where they're like, hey, you need to be a doctor, and you're like, okay. Don't punish me. I'll just do it. Let's talk about that, man.
Oh man, that's gonna be a long talk. But I'll kind of give you like the gist of it too. So as you know, I'm Vietnamese, but I immigrated over in 1975. I was actually one of the last helicopters to leave Vietnam, and so my dad was a colonel for the Vietnamese South Vietnamese Air Force, and he was actually responsible for a lot of the airlifts out. So when we immigrated out, we were just kind of escaping a little from that time. So, but once we got here, I have 4 other brothers. 3 of them are physicians, and was a former COO for a semiconductor company, Marvell, and he retired early. He's like he retired at 40. That guy made his money. But I think going back to your question about upbringing, as you're first generation, right?
Mm-hmm.
Okay, so I think first generation Vietnamese children, they have a certain amount of trying to prove something, right? I think there is a lot of gratitude for our parents trying to change their life in order to look forward for the next generation, right? And so my dad was very authoritative, military guy. You need to do this, you need to do that. Okay, if you want to be successful, education comes first. That's first. And so that really kind of imbued in terms of my brothers going to being physicians, and then the other person doing fantastic electrical engineer that made his name in the world. And so I have this kind of background of being very proactive, and that's just my dad too. I mean, he was like, you just gotta do it, you gotta do it, you gotta do it. All right. And so how I became the dentist out of the whole bunch of things, I was in that more of that artistic type of person. I like to do things artistically, and so I think that was allowed me as an outlet. And so the other alternative when I graduated from Vanderbilt was I was going to be an art curator. So it's like, which one's going to pay the bills better? This is the Vietnamese thing.
Did you bring that to your parents about what your choices were?
Yeah, I said museum or being a doctor. I think most Vietnamese kids will relate to that. It's like, you only call me a doctor.
Yeah, exactly.
I either a doctor or garbage man. And I was like, you choose.
I love it. You know what? I'm going to ask you this question here because, like I said, people like friends of mine like Meghna Dasani and I talked to Arun Garg about this, and I talked to other other dentists of Asian descent, but other minority dentists as well. And I always ask them, I was like, man, the one thing that I wish I could see is that more, minorities would step up and step up in these organizations, or take a leadership position, or take a influencer position. And that's something that whenever I see someone like you, or see someone like a Meghna Dasani who's like speaking and whatnot, I'm like, man, you know what? Like, I think it's so awesome to see someone like you or someone like us up there on stage and talking. It sends like a big message there. And some of the younger doctors I've talked to, I'm like, hey, why don't you just step up and stuff? And they're like, you know what you do, Glenn, that's your personality. I was like, no, man, you can do it. You got, you're like, there's some really talented dentists there that could really step up. And they're always like, well, I don't know. And let me ask you this, Thomas, because for someone who has a leadership position in a large organization, right? Sure. That you're doing all these things. For that dentist who's watching right now, what's your message to them?
Just do it. I mean, I came from the same kind of background. If I had an opportunity to speak or do this, or trying to be up, in the spotlight, I think a part of our Asian maybe heritage in general, they tend to be much more reserved. I think it's a cultural thing. Yeah. Right. And I was that way too. But then I wanted to take a spin on it, is that, you have a certain skill set, and you may be doing wonderful things in terms of whether it's dentistry or mentoring or whatnot, and you want to have that exposure. For those particular young people, is that when I say just do it, is that you are impacting on other people. If you have a certain talent and you can make someone else's life better from your talents, and whether you're applying your talents or teaching your talent, you are sending waves or ripples in this kind of wave thing, right? And then over time, it will affect other generations as you move forward in life. And so, I got to that point in my career that, in being in a position for the Florida Academy of Cosmetic Dentistry, is that I have this podium now that if I can make something very special and being effective for many generations to come, from being proactive and being an influence in terms of your own personal and professional development, then I think it's worth my time, right? Because you can only do so much in your office. You make impactful things for your patients, you make impactful things for your staff, and so forth. How do you extend off from that? Your colleagues, your mentees, and so forth. And that has a ripple effect going forward and forward and forward. And that's how I think of things. And this is what you're doing too, and what you're doing is very, very special with Nifty Thrifty, is that you imparting some of your knowledge and influence to help others, and then they will help others going forward. So I think that's I suggest to do it. Just do it.
I love it, man. I love it. It's fun. I'm going to share you this story. I would say, no, it actually is my very first speaking gig was at a podcast meeting called Voices of Dentistry. Myself and my podcast partner, Vin Nguyen, we were there. And so we spoke and we did some stuff, and then we had our own booth, went back, and a whole group of Asian dentists actually came up to us. They're like, hey man, we love your show. We love this. And they said, man, we were so happy that one of us made it. And me and Ben looked at each other like, what? It's not like we won the Oscars or something, but the significance really, it finally dawned on us there. And so when I see you, Thomas, I'm thinking to myself, dude, I got somebody made it, man. He's the president of this organization. But, people like Nathan Ho, people like Sonia Shah, Shaquille Ngadi, Meghna Dasani, all these people, I can keep naming all these people. But, when they're speaking or when they're stepping up like that, it really opens the door for another young dentist that's looking and say, you know what, I want to make a bigger impact than the four walls that surrounds me in my practice. I want to go beyond that. Yeah. So yeah, I wanted to talk about that, and that's so inspiring. And guys, he's very approachable. Message him anytime. He's a wealth of information. But if anything, if you guys go to the meeting, you got to meet the man. So you know what? You might see me there. You know, I think you motivated me with that. Number one, that speaker lineup, but just the fact of just meeting you and meeting all these people and connecting, that's going to be so huge. So Thomas, I know you got to tuck the kids in. So I'm going to let you have the last word. Any final thoughts as far as like the meeting or anything else or dentistry? And I'll let you get the last word in.
I was talking to a few students. I was actually at the Florida Dental Convention just this past weekend. And these students are, I had asked them simple questions like, what are you going to do after dental school? Where are you going to get your education? And they kind of were deer in headlights, essentially. It's like, we have to learn? Okay. Isn't it enough? It's like, yeah, well, you kind of do. I mean, then, and I understand, you have students that are having an average debt of $300,000, $400,000 in debt. Mm-hmm. And when I went to school, it wasn't that much by all means. And we got, we pay through. But now they have a very looming debt they have to take care of, right, for their own living. And I talked to another students, like, and we were talking about full mouth reconstruction and so forth. And it's like, and he said, can you direct me to the YouTube page that you learned that from? I was like, YouTube, you're talking. So let me tell you something, right? Whatever you want to invest in, you got to invest in your education first and foremost, all right? Because it will send ripples along the way in terms of your learning. But at the same token, and this is what I want to kind of culminate to this point here with these bigger students that are coming out. Is like the day that you feel that you're going to get overwhelmed. And I just came off from also another meeting that has to do with the American College of Dentists. And there was actually a very young dentist there. She did an essay on ethics in terms of, should I be doing this particular procedure? And even though that other dentists around saying, oh, I should do this and this and this, that was very lucrative, right? The day that you start to compromise your internal integrity is the day you compromise your dentistry for your entire career. Very simple as that. And so when I talk about dentistry and being a leader in dentistry is about keeping your integrity intact and trying to learn as much as possible so that you can provide not only great dentistry for your patients, but your peace of mind at the end of the day when you leave that office. All right, and so that's why I want to leave with, particularly for those students out there that are listening, and hopefully I can help you in terms of sending you in the right path.
I love it, man. There's nothing else I can say after that. So, guys, I'm gonna get Thomas to put the link in the comments section. He's pretty active on social media, but now that I tagged him here, guys, if you have any questions, just reach out to him. Literally, I mean, he's very easy to talk to. He's got a wealth of information, and if you're first of all, if you want to go to Orlando, like I love Orlando, just come out there, go to the meeting, write it off, right? Hang out with some cool people, learn some CE, you want to go Disney World afterwards, go ahead and do that. But if you're in Florida, I know we have a lot of Floridians. If you're in Florida, you got to make this meeting. So Thomas, thank you so much for taking some time out, man. I love it, man. I love what you're doing. Inspiration, man. And we'll have to bring you on again, man. I'm sure we'll have to bring you on again. But Thomas, thank you so much, buddy. I appreciate it.
Hey, love for the getting the invite, Glenn. I mean, it's always a pleasure, man. I mean, the things that you're doing and being actually represented for our culture too, that means the world to me. And so, but I congratulate you for that.
Oh, thanks. All right, guys. Well, thanks for watching. We'll see you later.